George Foulkes to be followed by Ian McKee.
Thank you, Presiding Officer. Can I also welcome this debate with just one reservation I'll return to later. Can I also apologise for having to leave for part of the debate for an engagement that I'd arranged previously. I also want to join in the congratulations to the UK Organ Donation Task Force for producing an excellent report, which I think does provide a number of welcome recommendations, which I think will improve organ donation services and the rates of organ donation right across the United Kingdom. And while I do welcome the Task Force recognition of the importance of improving organ donation rates, I am, like some others here, disappointed that it doesn't also recommend that we proceed straight away to an opt-out system, and that's the phrase I will continue to use always, for organ donation, for which I believe there is a very strong argument which I want to make. The number of people on the transplant waiting list in Scotland stands currently at 818. In 2005, September 2005, it was 695, so it's growing. And in 2007, only 271 organ transplants took place. In my own area of Lothians, 135 people are waiting for an organ transplant. And in England, one person, according to the Department of Health, one person dies every day due to failure to find a suitable donor. That is the context that we're looking at it in. Every year people are dying needlessly while waiting for a donor, for an organ. And it's evidence from many other countries that has shown us that an opt-out system can address the shortage of donor organs and can save lives. And also, public opinion research in this country has found growing support for a change to a system with more than 60% of the people in favour of an opt-out system, with safeguards, of course. So it was with some concern and growing disbelief that I read the report's findings that there was no convincing evidence to suggest that an opt-out system would deliver significant increases in the number of donated organs. You just have to look at other EU countries, forget about beyond that, and we find 19 operate an opt-out system. And as has been said on so many occasions, Britain's organ donation rate is substantially less than half of that in Spain. Now, I do accept that in Spain it is due to a combination of the necessary infrastructure and the opt-out, which produces that rate. But that does include the opt-out. Britain only achieved an organ donation rate of 12.8 per million, compared with Spain's 35.1. What other evidence is needed? Perhaps medical opinion. Dr. George Fernie, a member of the BMA's Scottish Council, said in response to the report, the BMA is disappointed at the task force findings. And he went on to say that opt-out, together with sufficient surgeons, intensive care beds and transplant coordination, was needed. Again, that combination, just as in Spain. However, yes?
George Foulkes keeps mentioning Spain. Would he not accept that in the last Parliament we took evidence from Spain on this, that the task force took evidence from Spain, and they said in their evidence that it was the structure that was important, not the opt-out? You don't seem to agree with the evidence.
I think Mike Rummels is entirely wrong. It's the combination of the structure and the opt-out. Everyone I've spoken to says that. And, however, although the recommendation to at least review the position of introducing an opt-out system is welcome, it's on the understanding that the Scottish Government invests money and effort to implement the other recommendations. And I welcome John Forsyth's appointment also. I welcome the Cabinet Secretary's willingness to consider early review. But Ross Finney is right. That means it's quite open for her to accept Richard Simpson's amendment. It would do precisely what she said she wants to do in her speech. We want donor numbers. We need donor numbers in Scotland to double. If we accept what the task force recommends, they themselves say it will only increase it by 50% in 5 years. No, I'm running out of time. So we would never achieve that. In order to achieve this, the Scottish Government has to provide the necessary funding and resources, employ specialist staff, and have a hard-hitting national campaign. And then we will be lucky if we reach a 50% increase. Now, my one reservation about this debate, because it has been a little like Groundhog Day, we're all making somewhat similar speeches to previous debates, and some sceptics, not me, some sceptics have suggested that the government's decision to have this debate is because it doesn't want to debate some of the other things that it was offered and which haven't had similar level of scrutiny,
1 minute.
like bed blocking, increased waiting times, shortage in free personal care, improved cancer services and so on. Now, I would hesitate to say that, but sceptics say that. So in summary, Presiding Officer, we should immediately start to implement the task force recommendations. But we must also be ready to revisit the possibility of introducing an opt-out system well before those 5 years. If the enhanced voluntary donation system is not producing the extra organs urgently needed, more people will die unnecessarily.
Ian McKee.